Entamizole, diloxanide furoate metronidazole.
Before watching this video, click on the subscribe button.
Composition is diloxanide furoate and metronidazole. Treatment of amoebiasis and giardiasis. 15 tablets. Amoebiasis. Amoebiasis or amoebic dysentery is an infection of the intestines caused by a parasitic amoeba as Amoeba histolytica. Amoebiasis can be present with no mild or severe symptoms. Symptoms may include lethargy, loss of weight, chronic ulcerations, abdominal pain, diarrhea, or bloody diarrhea. Entamizole is an approach in the management of amoebiasis offering therapeutic benefits over the previously available regimens. It is a combination of diloxanide furoate, a luminal amoebicide. Entamizole thus constitutes a potent and comprehensive therapy for all forms of amoebiasis. Okay, now I am talking about the indications. So the Entamizole DS is indicated for the acute amoebic dysentery, chronic intestinal amoebiasis, giardiasis, hepatic amoebiasis, and other systemic diseases due to E. histolytica. Now I'm going to talk about the dosage. So the recommended dosage of Entamizole DS for adult is 1 tablet thrice daily for 5 days. In refractory cases, the treatment can be continued up to 10 days if desired by the physician. Prolonged administration, for example as a prophylaxis, is not recommended. Now, what's about the contraindications and warnings? So, the hypersensitivity to the active substances or to any of the excipients avoid during pregnancy. Prolonged administration, for example, as a prophylactic, is not recommended. Regular clinic and laboratory monitoring, especially leukocyte count, are advised if administration for more than 10 days is considered to be necessary, and patients should be monitored for adverse reactions such as peripheral or central neuropathy. Now, what about the treatment of overdosage? So, the early gastric lavage is recommended for gross overdosage. There is no specific treatment. Keep all medicines out of the reach of the children. If you like this video, so don't forget to click on the subscribe and share button. Thank you.